Also, could you have injury to the heart? We need to open up the chest, do a thoracotomy. I think I haven't done enough Arnold Schwarzenegger impressions during this YouTube video. Hey everyone, welcome back to Movie Diagnosis. For those of you who don't know, I am Dr. Dustin Harris, and I'm a professor of emergency medicine. Here at Movie Diagnosis, we apply real medicine to fake movie injuries and diseases. And tonight's movie is Terminator 2, Judgment Day, a James Cameron film from 1991. So, as always, spoilers ahead, and if you like what you see, please consider subscribing to this channel and liking this video. Let's get right into it. Okay, so this first clip is a quick futuristic war scene, so let's jump right into it. Okay, so a lot of things going on, so let's break it down. So first we have lots of laser guns going off, and since laser guns don't exist, it's hard to know how hot the lasers actually are, because most of them would cause severe burn injuries. If you take the 1985 movie Genius with Val Kilmer, they say that the laser that they built is about as hot as the sun or even hotter. So conservatively, the surface of the sun is about 9,000 degrees Fahrenheit. I knew that, I didn't have to look it up. And that would likely cause third-degree burns to these patients. So treating them as burn injuries, we would treat them with IV fluids, antibiotics, and likely consult a burn specialist for possible grafting or more conservative wound care. Also, the gunner on the back of the turret with the quick rollover, you can see his spine, his neck snapping to the side. So we're concerned about possible cervical spine injury in those. So you want to make sure anyone with cervical spine injury or concerned about cervical spine injury, that they wear a rigid collar, not just the actual spine you're worried about all the vessels in the neck, as well as the airway and the digestive tract. So the neck is very important, so you want to make sure you protect it, get some advanced imaging, including the CT scan, possible MRI, and you might need to have a surgical consult after that. So, as I forgot to mention, Arnold Schwarzenegger is in this movie. This is probably the movie that really made his career and launched him off into movie stardom. So here you see him in a bar, and he's causing a little bit of trouble, so let's watch. He's right. Okay, so first we have the initial grab of the motorcycle rider's hand. You hear a little bit of bone cracking, so there might be some broken bones in the hand, possibly the elbow area, so you want to make sure you get an x-ray. If there's any angulation or dislocation of the bones, we need to relocate those first. So you can either use a regional block where you numb up the nerve, or actually numb up the hematoma that the bone created because it's bleeding into the area where it's broken, or you can actually use procedural sedation or give sedative medications to kind of put you in kind of a twilight or sleep state to put the bones back into place. And then you put a cast on, and then it can either heal on its own or it may need surgery with specialists in the future. The second injury I want to talk about is actually throwing the motorcycle rider through the window, or sorry, through the glass onto the hot plates. So again, another burn injury. He likely mostly only burned his hands because he's wearing leather jacket and jeans, so those are likely protecting him from the stove. But again, some conservative burn management, possibly first-degree burns or second-degree burns. They'll have to be examined for any type of blistering. Again, probably local wound care applied to those. Lastly, at the very end of the clip, you see Arnold Schwarzenegger stabbing the bar attendant with a knife, and it goes pretty far deep. It looks like it enters kind of in the trapezius area, and if you go deep enough through the posterior thorax, you do encounter the lung. So there is a possibility that he actually collapsed his lung with that knife. So if the patient is under a lot of distress, you can use a needle to decompress the lung if he's under tension or tension pneumothorax or collapsed lung. If there is time, you can put a chest tube in to try and equalize the pressure, because as the patient breathes in, the air will enter the lungs and then exit the lung where there's actually the injury, and then keep accumulating the thorax area, and all that air that's accumulated around the lung, that causes more tension and more pressure on the lung, and it can't fill each time they actually breathe in. It can be very dangerous for the patient. It can compress the heart and not just stop you from breathing, but also cause circulatory collapse as well. So either using a needle decompression or actually placing a chest tube if you have time. Okay, so this next scene is probably one of the most gruesome injuries in the movie. I remember seeing this actual injury when I was a kid and probably having nightmares from it, so let's watch.
Hey, Janelle. What's wrong with Wolfie? I can hear him barking. Is he okay? Wolfie's fine, honey. Wolfie's just fine. Where are you?
What's the parents did?
Your foster parents are dead. I think I haven't done enough Arnold Schwarzenegger impressions during this YouTube video. So if you look closely, you can see the knife going through the back into the mouth, through the back, and kind of up to the posterior head, maybe near the occiput area. So something we remember in emergency medicine is C3, 4, and 5 keep the diaphragm alive. So any injury above C3 can stop you from breathing because your diaphragm no longer contracts or expands, which helps increase the volume of your thorax, which helps the lungs inflate and compress. So if you open the mouth or get an x-ray of the mouth, you can see C1 and C2. There'll be a picture of it right in the back of the mouth. So if it went straight back, that would be an injury to the upper spine area, and any nerve function below that would cease to be. Now, it was angled a little bit upwards, so there might have actually been some brainstem injury, which could also cause you to pretty much essentially die right away. So that was a devastating injury. There probably isn't much we can do about that to save his life, unfortunately. Okay, next we have a vending machine scene with actually two twin brothers who are actually used in multiple movies in the 80s and 90s. So let's watch.
Hey, I got a full house.
That's good, Lewis.
About lucky day.
Okay, so whenever there's a penetrating injury, do not remove the penetrating object, because that penetrating object could be tamponading the actual bleeding of the vessels that it has penetrated. Now, the injury there kind of reminds me of the tale of Phineas Gage. So those of you who don't know, here's a picture of him. He was a railroad worker, I believe, who fell on a bar that kind of penetrated through his mouth and out through his eye, and he actually survived. He did injure his frontal cortex, and he was actually more, I think, uninhibited after that. Please look up the story. It's very, very interesting. Taught a lot in neurology and neurosurgery, but I would leave the actual penetrating trauma in this case. It actually goes through the eye, which a lot of neurosurgeries actually start by going through the eye. It's a very quick access to the brain, and I would get further imaging if possible if the patient was stable, or bring the patient to neurosurgery so they could remove it safely and then also stop any bleeding or try to repair any injury that may be there. All right, this next scene's a little short, but let's watch it. Okay, so the scene kind of continues a little bit longer. So there's more gunshots. Dyson has the bomb and he kind of holds his hand over it, and right as he dies, he drops his hand and the bomb goes off. So this is a classic polytrauma case, multiple gunshot wounds, and the patient now lost a pulse, they're now dead. So what do we do? A, B, C, airway, breathing, circulation. So airway, the patient they have no pulse, they're not breathing, they need to be intubated right away. Breathing, the patient does have multiple gunshot wounds to the chest, likely has collapsed lungs, they'll need some chest tubes, sometimes bilateral chest tubes. Circulation, no more pulse. Why don't they have a pulse? Well, he could be bleeding out, could be bleeding into his stomach, could be bleeding into his chest, so the patient needs lots of blood. Massive transfusion protocol activates, so that gives you blood, platelets, plasma, whatever you can get, give it to the patient. The patient's dying, so you need to do whatever you can to get them to have a pulse back. Also, because you have injury to the heart, we need to open up the chest, do a thoracotomy. So we cut open through the ribs, between the ribs, spread them open, expose the heart. Is there blood around the heart? Is there injury to the heart itself? Or we need to actually shock the heart or repair any injuries to the heart, sew them together. There'll be a lot of people working on this patient right away to try and get them to get a pulse back. They need to go to surgery if they are able to save their life, but there could be many different things going on. You don't have time to figure it out. You just have to treat everything all at once and hope for the best. Chance of survival is fairly low, unfortunately. All right, the next injuries are for our orthopedic colleagues out there.
Get down on the floor and face down! Down on the floor now! Okay, drop him!
Okay, so in this scene, Arnold Schwarzenegger is trying not to kill anybody, so he does a lot of lower extremity gunshot wounds, so lots of the patella, tibia, fibula, as well as the femurs. So the patients likely have orthopedic injuries, so those need either splinting. If they are open fractures, they might need surgery. If they're compound fractures, also might need surgery. They probably need antibiotics. There are a lot of big vessels in the legs, so femoral artery, femoral vein. If those are injured, patient may need blood transfusion or possibly vascular surgery. So get some x-rays, possibly need a CT scan, and talk to your orthopedic colleagues as well as possibly your vascular surgeon colleagues. You always want to make sure you check a pulse and neurologic function of any extremity injury, because even a broken bone could injury to a vessel or injury to a nerve, and sometimes you can't get those back. So be careful. Okay, we made it. Our last clip. Won't set it up, let's jump right in. So I wasn't really talking about the Terminators in this kind of YouTube video, but let's talk about the T-1000. Let's imagine it was actually a person who fell into molten metal. So molten metal is somewhere between 1300 and 1500 degrees Fahrenheit, so likely to cause third-degree burns. Systemic third-degree burns, what are you worried about? You're worried about muscle breakdown and degradation that can cause kidney injury, dehydration, infection, electrolyte abnormalities that could be pretty severe and cause cardiac arrest. If someone is burned systemically, and whether it's an extremity or their torso, that can cause a lot of swelling in their muscles and their tissues. And since the skin is so scarred, there's nowhere for the muscles or tissues to expand, and that causes compartment syndrome, which I did mention in one of my previous videos. So what do you do for something that's causing compartment syndrome or compression of the veins or vessels or nerves of a compartment in your extremities or even in your chest or stomach? Well, you have to do an escharotomy, which is where you actually cut open the skin to provide that extra space, extra surface area, so the swelling can continue without causing compression of the vital vessels and vital nerves. So systemic burns, again, we can talk to our burn specialists, IV fluids, IV antibiotics, watch out for compartment syndrome, and might need to even take their airway because of so much swelling. They have swelling in their airway. So even if it's not swollen at this time, you want to make sure you can intubate them immediately before it's too hard in the future. All right, so that's it. That's our last clip. So thanks for joining me. If you like this content, please like and subscribe. Comment below if there's a movie that you want to see in the future. As always, it's medical practice, not medical perfect. And once again, I'll be back. Have a good one.